Hello, my name is Patrick Hackenberry with Onward Shield, and welcome to my Medicare 101 presentation. If you'd like to get in contact with me, my phone number is 706-699-2301, and my email is patrick@onwardshield.com. Alright, just a little bit about me in this Medicare presentation. I'm a licensed agent, and I have extensive experience and training in Medicare. I'm certified to sell Medicare with several different carriers. I will help you understand Medicare, help you enroll in the right plan, and maximize your benefits. Now, I am an independent agent, and as a result, I'm able to compare all the plans available to you on the market. I also have a team of professionals who can support you whenever you have questions. Basically, I help you cut through all the noise. When you're learning about Medicare, you have many comments and questions like, why are there so many plans? What's a deductible? I keep getting spam calls. What do I do? Which doctor can I go to? How do I use my over-the-counter benefit? Can I get on Medicaid? Are my new drugs covered? So basically, I help people with all these questions. I assist clients in every type of scenario. The most common ones are listed below, like when you're turning 65, or if you're older than 65 but losing insurance, like you're retiring, unsure whether to stay at your employer insurance or enroll in Medicare. This is a big question for a lot of people. Or you're unhappy with your current coverage, or you might be on Social Security disability. Basically, Medicare came about. It's a government program. It's a federal health insurance program. It's the U.S. government's largest health insurance program, serving more than 62 million people. Now, Medicare is for U.S. citizens and legal residents. Medicare is individual health insurance. So Medicare is not Medicaid. Medicaid is more income-based. Medicare, although it works with Social Security, it's not Social Security. Your Social Security benefits are different than your Medicare. And Medicare is not a family plan. You can't get on Medicare with your spouse. It's an individual health insurance. So who can get Medicare? You can qualify for Medicare if you meet one of the following requirements. You can get on Medicare within 3 months of turning 65 or older, even if you still work. So, for example, if your birthday is in April, count back 3 months. So in January, you can sign up for Medicare. January, February, March. Your birthday was in April. So within 3 months of turning 65, you can sign up for Medicare. Now, if you're younger than 65 but you have a qualifying disability, you can get on to Medicare. Just a note here, you may also be eligible for Medicare Part A through your spouse, though you must meet the age or disability requirement. So what does original Medicare cover? One of the key terms you're going to hear is original Medicare. Original Medicare is designed and offered by the federal government. The only part of Medicare that has anything to do with the government benefits is called Original Medicare, and that is Part A and Part B. So when you sign up with the government for Original Medicare, you are signing up for Part A and Part B. If you're signing up for anything else, that's not a government program. That's not Original Medicare. So Original Medicare Part A is your hospital insurance. That includes your hospital room and your meals, intensive care, skilled nursing facility, operating room services, hospice care. That also includes your rehabilitation services, some home health care, and some drugs and medical supplies for inpatient stays. So Part A is basically hospital insurance. The other part of original Medicare is called Part B. Part B is medical insurance. That includes your doctor visits, an annual wellness visit, and preventive services. Notice I didn't say your annual physical, it's a wellness visit. Also includes outpatient care, mental health care, clinical lab services, durable medical equipment, ambulance services, and occupational physical therapy. So what does it cost? Well, the original Medicare Parts A and B, the premium, that's the amount you pay monthly. Part A, the hospital insurance, has a $0 premium. That's for most people. Now, this $0 free premium, that's if you or your spouse have worked and paid taxes for at least 10 years. If you don't get the premium-free Part A, then you do have to pay up to $505 each month. It can be lower, but most people have worked at least 10 years by the time they're 65. And if not you, then your spouse. Now, the Part B, the medical insurance, that's for your doctors. In 2024, the Part B medical insurance premium per month is $174.70. So just like all other types of insurance, you're going to have a deductible and other costs. So Part A has a $1,600 per benefit period deductible. That means if you go into the hospital, you pay the first $1,632. That's a 2024 price. That goes up every year or can change every year. And this is per benefit period. So in the spring, if you go to the hospital and you have to pay the first $1,632, then later on in the summer or in the fall, you go back to the hospital for something else, you have to pay that deductible again. This is not a yearly deductible. Now, Part B, you have a $240 deductible. Now, there are other costs. Part B, the main problem with original Medicare is that it only covers 80%. So you have to pay the other 20%. So if you have a $10,000 surgery, you would have to pay your $240 deductible and the other 20%, because Medicare only pays 80%. Now, the hospital insurance has other costs. That's if you're in the hospital a long time. So like days 61 through 90, you would have to pay $408 per day. Now, as you can see, original Medicare Part A and Part B has some problems because nobody wants to pay a $1,632, like $1,600 deductible if you have to go to the hospital. And nobody wants an unlimited 20%. Now, there is also something called IRMA, which is where, depending on how much you make per year, you might have to pay more than the $174.70. So let's take a closer look at the Part B. Let's look at the detailed cost by income bracket. So if your yearly income in 2022 was, let's look at the filing joint tax return. You and your spouse filed jointly. If your income was $206,000 per year or less, then you have to pay the $174.70. So if you're a high income earner with over $206,000 per year, that would move your Part B monthly premium to $244. Now, if you're single and you file an individual tax return and you make over $103, then you would pay the $244 per 60. And remember, this monthly premium is per person. So as long as you make under $103 if you're single, or under $206 if you're file a joint tax return, then you would pay the $174.70. Okay, let's talk about what's not covered by original Medicare. Remember, original Medicare is only Parts A and Part B. So original Medicare it doesn't cover all the cost. It only covers 80%. That means that other 20% is your responsibility. Original Medicare does not cover prescription drugs. So when you go to your pharmacy to get your prescriptions covered or filled, Original Medicare Part A and Part B, there's no drug coverage. So you would have to pay out of pocket. It does not include dental insurance or vision or hearing aid coverage. It doesn't include eyeglasses or contacts, and it does not include long-term care. And it does not cover most care outside of the United States. I skipped one. Original Medicare does not cover an annual physical. It does cover an annual wellness visit once every 12 months, but a wellness visit is not the same as a physical exam. So these are some of the shortcomings of Original Medicare, which is okay. So if there's some shortcomings, some people like to call this the gap. So to cover these coverage gaps and the cost, you have two options. Now we have two different options that most people do in order to cover those gaps. So one choice is you buy a Medicare Supplement. That's also called a Medigap plan. So Original Medicare Part A and Part B is from the government. These other two choices are from private insurance companies. So a private insurance company can sell you a Medicare Supplement, or that's also called a Medigap plan. And that covers the out-of-pocket costs. So basically, Original Medicare would be your primary insurance. It would pay the first 80% of your cost, and then this Medicare Supplement plan would kick in and pay the other 20%. Now this option, when you buy a Medicare Supplement, in the slide here it says that's the set it and forget it. You would have a monthly premium for your Medicare Supplement. And you would also need a Medicare Part D plan. I mean, you wouldn't have to get it, but it's a choice. And this would help pay for your prescription drugs. And that would also have a monthly premium. The second choice is more of a pay-as-you-go, and this is something that you would still have Original Medicare. So both of these choices, choice one, set it and forget it, or choice two, pay-as-you-go, you still have Medicare Part A and B. You still have to pay your premium for Part B, your $174.70. But the second choice, this pay-as-you-go, this is what is known as Medicare Advantage. It's also called Part C. What Medicare Advantage or Part C does, it's a plan that you buy from a private insurance company. It's a bundled plan where it includes the benefits of Part A and B, and it includes Part D normally. And it may offer additional benefits such as dental, vision, and hearing. So if you do the Medicare Advantage route, you are dealing with a private insurance company. So this is going to act more like your insurance you've had at your employer, most likely. You're not dealing with the federal government. So you're going to have some things that you're used to, like networks, premiums, deductibles, co-pays. All right, let's talk more about the Medicare Supplement plans. So Medicare in general has parts. So the Medicare parts are Part A and B. Now a supplement plan has plans, and these are letters also, just to keep you going on the alphabet here. You pay a monthly fee in addition to the Part B premium, and the private plan covers the costs left over from Original Medicare. So there's 8 different plans. They all have their own letter. The most popular letters or plans are the G plan and the N plan. These are standardized by the federal government, but you buy a supplement plan from a private insurance company. The monthly fee can generally range from $50 to $350 per month, depending on the plan type and your home state. Now, a Medicare Supplement plan does not include drug coverage, Does not include dental, hearing, or vision. If you sign up when you first turn 65 or when you start enrolling in Part B, you have 6 months to sign up for a Medicare supplement in order to get it with guaranteed issue. That means no medical underwriting. A Medicare supplement is guaranteed renewable. That means as long as you pay your premium every month, every year, you can just keep the same supplement, and it just renews no matter what happens to your health. There's no networks. This is Medicare is covered nationwide, so if you travel or go anywhere within the country, you don't have to make sure your doctor's in your network. You don't have to go to a certain hospital or a lab. A Medicare supplement plan works with Original Medicare, Parts A and Part B, and then your supplement pays the extra 20%. So looking at these different Medicare supplement plans, you see the letters across you have A, B, D, G. So by far the most popular plan is the Plan G. The second most popular plan is Plan N. Original Medicare Part A and B, you have co-insurance. That's the extra 20% that you have to pay out of pocket. If you have a Plan G or a Plan N, your Medicare supplement will pay that extra 20%. It would also cover your Part A deductible, though $1,632. Now these plans do not cover the Part B deductible, so you would still be responsible for the Part B $240 deductible. Now the main difference between the G and the N has a lower premium, but you have to pay co-pays. So when you go to the doctor, you would pay, say, $20 or $40, a different amount for a specialist or a hospital. You have co-pays with the Plan N. But monthly, it is cheaper. One thing about this, your Medicare supplement plan, this is the closest thing you can get to full coverage. No matter what happens to your health, all you have to do is keep paying that monthly premium. And Original Medicare, Parts A and Part B, pays the first 80%, and then your supplement kicks in and pays the next 20%. This means as long as you can pay your monthly premium, then you're covered. I mean, you could have a surgery, you could have any major health problem, you could have anything going on, and as long as you have the supplement in place, you're covered. And you don't have the headache of trying to see if your doctor's in the network, because there is no network. As long as your doctor participates in Medicare, which I believe it's like 98% of doctors in America participate in Medicare. Alright, so that was one choice. After you have Original Medicare and you add a supplement, that's one route you can take. Let's look at the other route. In this one, we're not doing a supplement. This is a separate route, and it's called Medicare Advantage. It's also known as Part C. But Part C in Medicare Advantage is not offered by the federal government. This is something that private insurance companies are contracted with, and you are buying a Medicare Advantage plan from an insurance company. Now, it includes all the benefits of Part A and Part B. You're still in the Medicare program, but the plans are offered by private companies. So you wouldn't be calling and dealing with Medicare, you'd be calling and dealing with a private insurance company. Now, most of the plans in a Part C Medicare Advantage plan already include prescription drugs. And many of these plans have a bundle where they include routine dental care, eye exams, hearing tests, and different wellness programs. Some of them have a bunch of benefits, like one's called Silver Sneakers, where you can join the gym and it's basically free. Let's talk about the cost. How much do you pay monthly for a Part C Medicare Advantage plan? Many of these plans have a $0 premium. So every month you still have to pay your Part B premium, which is $174, but to have the Medicare Advantage plan, you pay a $0 premium. However, you may have or you will have out-of-pocket copays and coinsurance when you use the service. Every plan has all the details, but you will have copays for all types of things like doctor's appointments, x-rays, MRIs, surgery, hospital stays. And typically these plans have an annual out-of-pocket maximum. So if you have a whole bunch of copays and coinsurance, if you hit a certain amount, then the plan will pay 100%. Now, there's other factors. These are insurance plans from an insurance company, so you might need a referral to see a specialist. You have networks. All right, let's talk a little bit about Part D. That's your Medicare prescription drug coverage. All the Part D, the drug plan coverages, these are all from private insurance companies. These are private plans that help cover the cost of prescription drugs. These plans cover most common medications. You can have a specific brand name and generic drugs according to the plan's formula. So a private insurance company has a drug plan. They have something called a formula. It's basically a drug list. And if your drug is on that list for that company, then it will be covered. And there's different tiers. Now you can get a Part D drug plan. You can get a standalone Part D plan. Say if you do original Medicare plus a supplement, you can also add a standalone Part D plan. Now if you go with your Medicare Advantage route, most Medicare Advantage plans include a drug plan. So how does this work? You pay a monthly premium, unless it's part of your Medicare Advantage. You have a copay for your medication, you have deductibles, and there's different tiers, and you might have to use a specific pharmacy network. So you do not sign up for a Part D plan through the federal government. You sign up for Part D with a private insurance plan, where there is also Part D IRMA, which means you would have to pay extra if you make more. So as you can see here, if you make over $206, you would have to add $12.90 per month to your plan premium. Now Part D, your drug plan, D for drugs, you have different coverage stages and you have a formulary, which is a list of drugs. So it's very important, whoever you sign up for a drug plan with, you want to give them a very detailed list of your current medications that you take, and you want to make sure the company you're signing up with covers those medications. Now during the year, these are yearly plans, so all these deductibles, they start over in January. So let's say you have a $200 annual deductible, and you have a monthly premium. So in January, you go to the pharmacy to get your medication, you're probably going to have to pay out of pocket because you haven't met your deductible yet. Now once you meet your deductible, say you pay that $200 that first month or so, then the plan will kick in and it will start covering to a certain amount depending on your plan. Now this coverage gap and this donut hole and these 4 different stages, this is all changing in January 2025. There will no longer be the coverage gap or the donut hole. So the way this is going to work is going to change in 2025. So basically your cheaper generic drugs are in lower tiers and your brand name drugs are higher. And so you're going to have a different copay depending on what your drug is. But let me repeat the most important part. Work with an insurance broker that will check your medications before you sign up for a plan to make sure that they are in the plan's formulary. Alright, so you have to make a decision. What should you choose? Remember, everyone will get on original Medicare Part A and Part B. Everybody will have that $174 per month premium for 2024. But our 2 options. Option 1, you'll be adding a Medicare Supplement and a prescription drug plan. That's a standalone Part D plan. Or option 2, you will go the Medicare Advantage route. That's where you're not really using your Part A and Part B, although you have to still pay that Part B premium. But everything in Part A and B will be covered, plus you'll get the additional benefits, but you'll be dealing with a private insurance company. So a Medigap plan, it has a cost. Sometimes it's around $200 per month. And these Medigap, which is also a Medicare Supplement plan, these have rate increases every year. And you will also have a drug plan, which can be anywhere from $1 per month up to like $30, $40, $50 per month. But once you pay your premiums, you'll have very low out-of-pocket expenses. In other words, you won't have co-pays, you won't have co-insurance. Whatever that bill is, original Medicare, Part A and B will pay the 80%, and then your supplement will pay the other 20%. Now, with this choice, you can go to any doctor, anywhere who accepts Medicare. You don't need a referral. You won't be dealing with insurance companies. If you need a surgery or a certain medication, as long as the doctor says it's medically necessary, it'll be paid for at 100%. So as long as you're willing to pay that monthly premium, then you can get on a Medicare Supplement plan and get a prescription drug plan. And option 1 is the plan that we said was where you can set it and forget it. Just pay your premium every month. And you know what you have to pay every month, so you can put it in your budget. Now the other route, option 2, is the Medicare Advantage route. It includes all the A and B benefits, but it's not ran by the federal government. They contract with a private company to run Medicare Advantage. This is typically a $0 per month premium. Yes, you still have to pay the $174 per month for Part B. And you have to pay co-pays and co-insurance for services. Now these plans do have out-of-pocket maximums. In 2024, the average out-of-pocket maximum was $7,500. So if you have a really bad health year and you have cancer, need treatments, and you have a whole bunch of procedures, the maximum you would have to pay would be $7,500. But remember, you have a $0 per month premium. So if you're not going to the doctor very much, or you're not having problems, then this would be $0 versus the Medicare Supplement that could be potentially $200 per month every month. Now the Medicare Advantage plans, you might need a referral to see a specialist. You're going to have a network, so you can only see doctors in your network. But the main selling point is the $0 premium. And a lot of these plans have big networks where you can still see your main doctors. So if you decide to go with the Medicare Advantage route, you have to make sure that you pick a plan with a company that your doctors participate with. So you want to have a list of any doctors that you like to see, like your primary care doctor, any specialist you might see, and which hospitals and labs you like to go to. And then you want to make sure that they work with that Medicare Advantage plan. So what should you consider when making this choice? This choice is a personal decision based on cost, convenience, and health history. Let's consider the following questions. What am I willing and able to spend on premiums, deductibles, co-insurance, and co-pays? Some of these would be set monthly, and some of these would be pay-as-you-go if you have an issue. Does the plan I'm considering have all the benefits I'm looking for? How important it is to me to have a vision, dental, and hearing services covered. Remember, if you go the Medicare Supplement route, that does not include a vision or a dental insurance. And yes, you can buy that separately, but all these separate supplement plans, they can add up, but then you would have coverage. Now, if you go the Medicare Advantage route, all these extras are bundled in together. You have to ask yourself, am I okay having a restricted list of providers and hospitals within a network? So if you go with Medicare Advantage, you have to check the network. You don't want to go to a provider outside the network and then find out that you have to pay for the whole bill. So, do you feel comfortable using this plan to manage any chronic health conditions? There are some special need plans within the Medicare Advantage. If you have a chronic condition like diabetes or a heart condition, you may qualify for different benefits. Likewise, if you receive Medicaid, which is ran through your state, you can receive extra assistance. Or if you're living in a nursing home and if you need additional care, there's different plans for you. They're called special need plans. So depending on your income and assets, you may qualify for additional assistance through either Medicaid or something called Medicare savings programs, and this will help reduce your Part A and Part B costs. There's something called Extra Help, which will reduce your medication costs. This is a low-income subsidy. And there's also local state assistance, different programs that we can help you find. All right, let's talk about when you enroll in Medicare and how you enroll in Medicare. So remember, Original Medicare, Part A and Part B is from the federal government. To enroll in Original Medicare, you have an initial enrollment period, which is 3 months before and after the month you turn 65. So if your birthday is in April, say you're turning 65 in April, you can sign up January, February, or March, or April, all the way up until July. So you have a 7-month window to sign up for Original Medicare. If you miss it, you can enroll during the general enrollment period. Now you might have to face late enrollment penalties. That depends on if you already have insurance at work. And if your work is credible insurance with more than 20 people, we can get into that later. But generally, you want to sign up at least for Original Medicare Part A before you turn 65. But you can't do it until you're 3 months away. So when you're 2 to 3 months away from your birthday, you want to sign up for Original Medicare Part A and most likely Part B. Unless you're actively working at a job that has credible insurance with over 20 employees. Now, how do you sign up for Original Medicare? You do it through the Social Security Administration website. So you're going to want to go to ssa.gov, and you're going to have to set up an account there with your username and password, and you're going to have to use your email, probably a cell phone number. So you want to get enrolled at ssa.gov for Original Medicare. That would be Part A and Part B. Now, if you have issues going to the website, you can also go to your local Social Security office and tell them that you want to enroll in Original Medicare Part A and Part B. If you need help doing this, let me know, or of course you can contact Medicare.gov or call it 1-800-MEDICARE. Now, let's say you want to enroll in a Medicare Supplement. You have a 6-month time period after the month you're 65 and older. From the point that you are enrolled in Part B, you have 6 months to enroll in a supplement plan to get a guaranteed issue. Guaranteed issue means they can't turn you down, they can't do anything about pre-existing conditions. So this is a big decision. If you want to go with a Medicare supplement, you need to do it right as you sign up for Part B. You have 6 months to do that. Remember, this is guaranteed renewable, so once you get that supplement, say you're really healthy at 65, you sign up for the supplement, you pay your premium every month. A few years later, say you get really sick, they can't kick you off the Medicare supplement plan, and you'll be covered at 100%. Now, you can still enroll for a Medicare supplement later. Say you wait a few years, or you take Medicare Advantage for a few years and then you want to switch over to a Medicare supplement. But if you enroll later, you could be denied based on your health history, or you might see higher premiums. You would have to go through medical underwriting. If you're fairly healthy, then you can probably still get a Medicare supplement. But if you have issues with your health, then you definitely want to do a Medicare supplement early on, 6 months from the time you turn 65 and you're enrolled in Part B. Alright, let's talk about if you're going to keep working past 65. So if you're working past 65, you may be able to delay enrolling in Medicare Part B. You have to be actively working. And if your employer has 20 or more employees, and if the coverage is considered credible, you'd have to talk to your HR department, find out if your current insurance is considered credible. Then you do not have to enroll in Part B, as long as you are actively working. Now, if your employer has less than 20 employees, or if the health insurance is not considered credible, then you do need to enroll in Part A and B. Otherwise, you could face a penalty if you try to sign up later. So, let's say you're turning 65 and you enroll in Part A, but you keep working. So you have health insurance at work. So you can delay Part B. Of course, you would delay it because it costs $174 per month. But then say you turn 67 and then you retire and you stop having health coverage at work, then you have a certain time period in which you can still enroll in your Medicare Supplement plan within 6 months. Or you have a time period to enroll in Part C and Part D. You have to be careful doing this, and you want to work with a broker that understands these different periods so that you aren't faced with a penalty. Let's say you want to change your plan. If you don't like your initial decision, there are certain rules, of course. Now, there is something called the Medicare Annual Enrollment. This is from October 15th to December 7th. This is like after you're on Medicare, or if you're on a Medicare Advantage plan. This is where you can switch from or into a Medicare Advantage plan. Or you can join, switch, or drop a prescription drug plan. There's also the Medicare Advantage Open Enrollment. That's January 1st to March 31st. This is open only to Medicare Advantage plan members to switch or drop plans. There's also special enrollment periods if you have a qualifying event. For example, if you move, if you lose coverage, if the private insurance company, Medicare Advantage, stops operating where you live, or say you suddenly become qualified for a special needs plan like diabetes, or say you start receiving state financial assistance like Medicaid, then you can change plans because you're having a special enrollment period. Now, these time frames vary depending on the special enrollment period. Yes, you don't want to be late. You don't want to have to pay a penalty. So when you're turning 65, you definitely want to sign up for Original Medicare Parts A and Part B, especially if you don't have health insurance from work, or if you plan on retiring. To contact me if you have any questions. Once again, my name is Patrick Hackenberry with Onward Shield. That's just my business name for my insurance business. I can get you set up on a Medicare Supplement plan, or I can get you set up on a Medicare Advantage plan. I can help you if you're not sure how to sign up for a Social Security account and how to enroll in Parts A and Part B. And then, of course, once you have Part A and Part B, I can help you either add that supplement, or I can help you find a Medicare Advantage plan that works for you. If you have any questions about this process or you'd like to meet with me, please give me a call at 706-699-2301, or you can shoot me an email at patrick@onwardshield.com. If you'd like to visit my website, it's www.onwardshield.com. Everything I do is about helping you to have benefits during your retirement. Hope you have a great day, and thanks for taking the time to watch this.